All right, first question is, what do variants mean? And why does COVID-19 have so many of them?
I'll take a stab at that one. Thanks, Allie. Uh, Coronaviruses and other RNA viruses that use RNA instead of DNA in their genome often have high mutation rates. It's part of the feature of these viruses to adapt to new host environments. HIV is a great example of that as well. But other viruses like the influenza virus can also rearrange their nucleic acids to create new variations. And that's why we have to formulate new influenza vaccines on a yearly basis. So I would say that coronaviruses don't mutate significantly more than those other viruses, but RNA viruses in particular do tend to create those errors, and it's an evolutionary advantage, really, so that you can continue to adapt, and that's how we get those variants. And so the original SARS-CoV-2 mutated into a variant that arose and started outcompeting that original virus, and that was the Alpha virus. You may have remembered from last year that grew out of the UK. And then we've had a lot of other variants, most notably the Delta variant that came from India that now has really taken over. And it's been interesting because as these viral variants of SARS-CoV-2 emerge, even in distant parts of the world far away from the US, it takes a few months for that virus to circulate in individuals worldwide and then become the predominant strain in the US. We saw that with the Alpha variant to some extent, and certainly with the Delta. So I will just wrap up this answer to say that that is exactly why we need to continue to vaccinate everyone worldwide. When we vaccinate folks in other countries and we stop the number of people, the number of reservoirs that virus can live and mutate in, we limit the virus's ability to create new variants. And it protects us at home too. So again, I'm probably preaching to the choir, but that's why it's important to get vaccinated.
Great, thank you, Dr. Zabel. Next, I was vaccinated in February/March and just contracted COVID. I have all the common symptoms associated with the virus and tested positive. After recovery, will my immunity be improved? Should I still get a booster, or did I effectively just receive one? Another question I got just the other day was, if I had COVID and have antibodies, are they stronger than the vaccine?
I will start and pick that one up and hopefully hand it off to others who have great opinions as well and thoughts about this. So yeah, this is one of those things that I think shocked perhaps the general public, that even if you have immunity to something, that immunity may not be 100% complete. And therefore, in some people, you can actually still be infected with the virus, even if you've been vaccinated. So every human body is different, right? And every human body responds to the vaccine differently. And as we heard in the early days of the vaccine approval, we have somewhere around a 95% efficacy, meaning that it prevents infection or at least severe disease in 95%. 95% is not 100%, right? So some people will have what we call breakthrough infections. And of course, you've heard a lot about that. And this individual who asked the question was asking about, they had just contracted the COVID symptoms and tested positive. So then the next question is, okay, did they just essentially get, quote, a boost to their immune system? And the answer is yes, they did. The question, of course, remains is that, and it kind of is relevant to the second question that you asked, Allie, is that going to be stronger or as effective of an immune protection as a vaccine? And so far, there's mixed evidence in that regard. I think the evidence leans a little bit toward the fact that natural infection does not have as robust an immune response as the protection that you get from a vaccine. So for this individual who just recently had COVID, if they are in the group of people where booster or third doses are recommended, most people are recommending, and I can, Dr. Jackson probably can maybe correct me if I'm wrong, but waiting at least 60 days before a vaccine after a natural infection. But if that person got COVID and was in that, let's say, immunocompromised or over 65 group, the answer is I would still go forward with a booster in the appropriate time window. Again, that would be something you want to discuss with your physician, so certainly can't make any individual medical advice. But the one thing that we do know, which sort of leans me in to say that, is that these vaccines are so incredibly safe. So as soon as it's safe for you to have it, if you're eligible to have that, then I would go for it, because it's very likely to have very low risk to you, much lower than anything harming you from getting that booster. But again, it does depend on the window of time after which you experienced natural infection. So I'll get some of the other panelists maybe to pipe in. I know Mark probably has a comment, maybe Rebecca also.
Yeah, Nicole, I agree with you. I mean, we were just talking about this at work. The evidence for natural immunity just isn't there yet. They don't know enough about it, and really the duration and how strong that is. They really haven't been able to prove that. So they are still recommending vaccination. Prior days where we would have outbreaks, as soon as people had resolution of symptoms, we were vaccinating people. I think at UC Health, they're typically recommending 30 days to wait. But otherwise, yeah, I would go ahead and get the vaccine, because what they're really good at is preventing the severe illness and death, hospitalization, those ICU stays. So it's definitely worth the while.
Yeah, I will not repeat all of the great answers and advice that Nicole and Rebecca just gave. Just say that I agree with that. I think that it might be surprising to some that a natural infection that kind of exposes your immune system to the entire virus is potentially less effective than a vaccine that just provides one part of the virus for your immune response to react against. But you have to remember that these vaccines are carefully dosed and measured and administered. So there's high consistency in how each individual that receives that vaccine is exposed to that part of the coronavirus that we're trying to mount an immune response against. In natural infection, there is no control of that administration or exposure. So some people may get a high exposure. They might get it directly into their nose or mouth. Some might get an aerosol that's been floating around for hours. So sort of the dosing and the ultimate route of entry for that virus is going to vary widely from person to person. And so you can get very widely varying immune responses because of that. Imagine if everybody went into the clinic and when they got their vaccine, some got it up their nose, some shot it in their mouth, some got it in their arm, some got it IV. And then try to figure out, if everybody got the same immune response. It would be crazy. So it's that variation in exposure and natural immunity, I think, that really contributes to the variation in protection from your immune system. And that's why vaccines are so important, because we go through the iterative steps of clinical trials to make sure it's safe, that the route is effective, and that it's protecting against the actual infection.
Thank you. Who are they considering for boosters at this time? You mentioned immunocompromised people. What defines someone as immunocompromised, and what proof is needed to make that booster appointment?
Well, I'll take the first swipe at this one. So as you know, and as we're now used to the fact that, recommendations and guidance is changing over time. So I guess the first part of answering that question is to remind people that probably the word booster is maybe not a terribly accurate way to describe a third dose, and that many vaccines require 3 doses or require doses that are further apart from one another than what we've done with the original Pfizer and Moderna doses, and even J&J. So, the initial goal of developing the vaccine and getting people the 2 doses, if you were a Pfizer and Moderna recipient, was really to get people as high of an immunity as possible. Like with shingles vaccine, for example, you wait 6 months between your first and your second dose. That's because the chances that you will likely develop shingles in between those 2 times is really small. And also the most effective time frame for your immune system to sort of get its quote booster is 6 months after that. We actually didn't know that when we started. We didn't know what the effective time was, which would be most effective. We knew it was very effective at 2 or 3 weeks after the first dose. So what I think is happening now is we're starting to see that perhaps these vaccines need either a 3-dose kind of regimen, or that the doses could be spread out a lot further to sort of enhance the length of time that we're all immune. So I always sort of kind of worry about that word booster, because it almost sounds like the first doses didn't work, and they do work. But the question is, how do you maximize the length of time that you're protected? And perhaps what we're now finding out is that maybe those doses should be spread out a little bit more. That's not to say that there's anything wrong with doing what has happened, and it's turned out to be a very safe and effective protocol, but it's not the end of the story. And as we've said many times on these panels, that science continues to evolve, and we're learning as we go. So then the question about who are in the group that's now recommended to get boosters, as far as I know today, it's people over the age of 65, anyone who's immunocompromised, which generally refers to people who are on some kind of immune suppressant, for example, organ recipients, or people with immune mediated diseases like rheumatoid and other diseases of the immune system that require immune suppression to control, and any other disease that potentially puts you at a higher risk of not being able to mount an appropriate immune response. And then the other newer recommendation was that residents living within nursing homes, as well as the healthcare workers and others that are caring for those individuals, they are also recommending boosters at, is it 6 months or 8 months? I'm trying to remember, after the first dose. So I think that is likely to continue to evolve, but that's where we are today. And I will end there and pass it along to someone else for more information.
Hi, it's Rebecca. I would just add, so that if you feel like you have an immunocompromised condition, it's worth talking to your physician about, because depending what type of medications you are, there are certain time frames that you need to adhere to when you're getting that 3rd dose. Like some rheumatoid drugs, you have to do it 6 months after your last dose of the medication. So it's worth talking to your physician. As far as UC Health goes, they've been, at least locally in the community, that's the only one I really know about. They're offering these 3rd doses if you qualify, and you really are able to go and sign up on their portal for their vaccine clinics that they're having down at MCR. And to my knowledge, I think it's based on good faith that you are following into these criteria to get this 3rd dose. So I don't believe they're requiring proof prior to your vaccine. I think they're just able to kind of verify it through your health record.
Yeah, and I will just add quickly that just again, recall that, we were developing these vaccines during the pandemic. And so this is really illustrative of the process of clinical trials, right? Because if in a best case scenario, if we were just working on this vaccine before it became a pandemic, that phase 3 trial would have taken a lot longer. We would have went out months after the first dose, and then we might have had the luxury of giving a second dose with a better timing, like at 6 months, like Dr. Earhart was suggesting. We didn't have that luxury. We were in the middle of the pandemic, and lucky for us, we were fortunate that that 2-week dosing regimen turned out to be pretty darn effective for the Pfizer and Moderna vaccines. But we didn't have time to wait to collect that 6-month data, right? And so we had to get those vaccines out as soon as possible. They had already demonstrated that they were very safe. That's always phase 1. Phase 2, that it was eliciting immune responses, so generating antibodies. And then phase 3 is really the proof of principle, right? The proof of the pudding. But now that we've been in this pandemic for a while, we're collecting that long-term data. And now that's why, it's becoming apparent that, that third dose may be required for full protective long-term immunity.
Thank you, guys. Why are people pretending like things are not getting bad again? I see so many people engaging in behaviors we would have considered much too risky during the height, but I feel like numbers are just as bad as before.
I'll start, and then I'd love Deanna to weigh in on this, because what I can talk about is really from the numbers standpoint. And we've done this panel a number of months now, and I have to say that every time we talk about numbers, it's really important that we remember that all of those numbers are somebody's mother, father, brother, grandma, grandpa, and they're not just numbers, they're people. And I think it's just really important to remember the human aspect of this whole thing, that many of us, all of us have been touched by this, and many of us have lost loved ones. And I just want to, acknowledge that, and acknowledge the fact that all of us have suffered to some extent. I think that also sort of leads to this kind of no end in sight mentality, and therefore, if it's sort of this all or none, like if you can't live the way you used to, then why not just throw caution to the wind type of thing. Or the other side of that coin is to be very, very cautious, or hyper cautious. What's different about now is that we do have tools to protect ourselves that we did not have earlier. And even so, we still know that we don't know everything. And for example, the Delta variant sort of thrown a big cog in the wheel of what we thought was going to happen, because it's so much more contagious. And therefore, these mask mandates and things are coming out, our recommendations are coming out that are a little bit confusing. So I think people are probably falling into more often into one extreme or the other, where they're just kind of like throwing their hands up and deciding that no matter what, they're just going to behave the way they always did, or they're so hyper cautious. And I think there's, a middle ground that we can sort of make these course adjustments to our lifestyles and to our risk-taking behavior based on our own risk of what happens if I were to develop COVID. For example, I'm a vaccinated individual. The likelihood that I will end up hospitalized if I were exposed to COVID is extremely small, like very, very small. And in Colorado right now, I believe the statistic in Larimer County is that 96% of all people in the ICU that have COVID, which represents about 50% of ICU beds in Colorado right now, are unvaccinated. So it's extremely unlikely that I would be very, very sick. Nonetheless, there's also certain behaviors I can do to mitigate my own risk. For example, it's kind of like wearing your seatbelt in the car. The likelihood that you're going to get into an accident is very small, but I can mitigate my risk of being very severely injured in a car accident by wearing a seatbelt. So there are certain things I do to mitigate my own risk, i.e. mask wearing in crowds, mask wearing indoors right now while we're dealing with Delta. But that doesn't prevent me from driving, if you know what I mean. Like, just because I need to put a seatbelt on doesn't mean I won't get in a car. So I think there are ways in which we have to remember that there's increments of behavior change and increments of risk of, taking that aren't all or none. And the question about why are we pretending it's not as bad, I want to hear what Deanna says, because I'm a little puzzled that there's sort of like, kind of the, put your hands in your ears and pretend type of thing. It's not as bad as we were before, because we have tools to protect ourselves that we did not have. But the numbers are very high, and the numbers, as we know, are, very much skewed toward people that don't have vaccinations. So therefore, there's a lot of human wood out there for this forest fire to burn through in the absence of people being vaccinated. And Mark brought up the idea that there's these, this vulnerable population of people, these people that haven't been exposed to COVID, who don't have immune protection from vaccines, even partial immune protection. And that's why we're seeing those numbers. Until we get people more of the population vaccinated, there's still a forest fire raging out there, and there's still a lot of fuel, i.e. unvaccinated people out there for this forest fire to hit. So I'll stop there and see what Deanna has to say.
I mean, I will second everything Nicole said. I think there's a lot of reasons people are doing that. I think one is fatigue, that there are some people who are just exhausted with having to live during a pandemic. That doesn't make it okay not to keep sort of moving forward safely. I think for a lot of people, and I appreciate Nicole bringing this up, I've heard people talk about, well, I guess the vaccines aren't working. So, and it kind of, I think, leads to people having this sort of learned helplessness that, look, I did this and people are still getting it. So what's the point? And I lean towards everything that has been said by this committee, which is nothing is that surprising. Like Nicole said, they are working. They're keeping people out of the hospital. And so nobody ever promised, I think, that you would never get it. It was to reduce these hospitalizations and horrible outcomes. We also, this is new. So we're learning every day how the variants are responding. And I think from a science perspective, none of this is too shocking. But I think on the receiving end, if you're not keeping up with the entire process, it sort of seems like things keep changing on a daily basis, and maybe people just feel like they want to give up. But like Nicole said, I totally agree. I'm baffled when I see large crowds of people inside. So the question writer, I agree with you, and I agree with what Nicole said. I think you have to make some decisions moving forward. As she pointed out at the beginning, even if you're vaccinated and very healthy, I think we still want to be thinking about other people who either have not been able to become vaccinated because of their age or because of their health, and just do the things you can. I mean, the best thing about where we are right now is we know things. We know that masks help. We know that vaccinations help. And so I think as much as we can, try and be tolerant of people who are not moving forward safely, but try and do your part as much as you can. And just understand that for some people, this seems sort of overwhelming, or they feel like there's nothing they can do, even though empirically we know there's lots we can do.
Thank you, guys. Speaking of continued patience with people, how can I talk to my family about my continued hesitation to come for a visit? We're all vaccinated, but I'm nervous to travel, and I know they participate in riskier behavior than I do. Am I overreacting? If I am, what about if they're hesitant to get the vaccine or believe that ivermectin will cure them?
Yeah, this is so difficult. I mean, I think we all have family dynamics without COVID, and so it's hard to know which part is that bleeding into these issues. I mean, ideally, you would be able to be as honest as possible with family members, while also being respectful. I think one thing people can say is, I'm not questioning what you want to do, but I have to move forward with what I'm comfortable doing. But I think one of the things that happens is people get on sides really quickly, and people get into these discussions where one option seems wrong, or judged by the other. And so it quickly sort of gets into maybe more volatile and emotional discussions. I think it's totally fair if people are cautious and they don't want to go travel and they want to postpone, to say, I would feel really much more comfortable if we could wait until I feel more comfortable. We always tell people, try to be very cognizant of the I's and the U's. So if you start the conversation with what you're doing is not okay, and you blah, 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 that typically is going to start it off not very productive. But if you can say, I'm in a place where I feel like I would be more comfortable if we waited a couple months, or I would feel more comfortable when everybody's vaccinated, or whatever it is that works best with your family. I don't have a perfect solution, but I think it's very fair to express your concerns of how you feel moving forward.
And hi, this is Rebecca. And I recently had a similar type of experience where, I had a family member that was like passing me information about ivermectin on a website and all these things. And I felt like I needed to respond just because I was worried about my family member actually taking something that could cause them harm. And so I think, it's hard because a lot of the information out there, when I was looking at this website for the ivermectin, it looked super professional. Like it was actually quite scary because it looked like something off of a CDC website. And so I could see where people might think some of this stuff is legit. So I think it's just, good to meet people where they are and just say, hey, the common line I use too with like patients, families, those kind of things is, we don't have the evidence for it. And the last thing that I want to do at this point is, have you do something that might cause more harm for you or your loved ones. So, trying to meet people with the science as best you can. But yeah, it is super hard to navigate in a world where there's so much information at our fingertips, and it can, misinformation is pretty widespread at this point. So just encouraging people to kind of look at those key websites and that whatnot. But I agree with the person writing the question. I've done the same thing. I've restricted some travel and all those things just because of that. And I think just telling people that's where I'm at right now. And I want to be safe. I want to keep my kids safe. And I also want to keep you safe. So that's where I have to be at this moment in time. So do whatever you feel is best for you and your family.
That's really, those two responses are so good. I can echo a lot of that. And I think the hard part, oftentimes when people are sharing information, it's for one of two reasons. They may be asking for what your opinion is. And like Rebecca, I have people, because they know I'm in the area of researching COVID and a medical professional, that people will ask my opinion, which I'm happy to share with them. But the battle that I never win, and probably nobody does, is when someone's really, committed to a belief that I may not agree with. For example, that ivermectin is going to cure you, or that vaccines are harmful. And I don't, if someone is asking my opinion or advice on something, I will share it, but I don't think it works to beat people over the head with information. I sometimes get a lot of the same types of information that Rebecca was talking about, where someone sends me some like bogus kind of medical journal or whatever. And one thing that I have had success with is just to say, whenever I'm reading any kind of science, I look for evidence of credibility. And these are the things that I do. I look for references and actually look at if those references are valid. I look at where the information came from and what the robustness of the science is. Now, I grant you that the average, layperson who may not be in the science field might have a difficult time doing that. But those of you who are on the call now know a bunch of scientists, us. And these kinds of panels are really good places to get very good scientific information. And other sites, for example, the CDC sites, the state health sites, are also really good reference areas that you can kind of double check against. But it is very hard to battle the misinformation, and it kind of hurts my soul that there's so many people who are wishing so much that either, they're so committed to their stance that they're anti-vaccination, or they want so much that there would be a miracle cure, that they're just not willing to be able to see any other things. And I don't know how you win there. I don't know that you can. And all you can do is give people the grace to have the freedom to believe what they want to believe, and be able to share your expertise, or at least, be able to share some information from science that you feel is trusted, for their consideration. And that's about all we think we really can do, I think.
Yeah, I totally agree. And Deanna probably, I'm sure, knows this a lot better than I do, that the emerging social sciences that, trying to tell people, that they should get vaccinated, or that they're wrong about their thinking of COVID is not the way to convince them that this is real and they should get vaccinated. And I think Nicole is right. There are some people that you are not going to convince. If someone is thinking that ivermectin is the way forward and not the vaccine, I think at that point, you're not going to be able to convince them that we've got hundreds of millions of data points that the vaccine is safe and effective, and almost zero data points that ivermectin is effective against COVID. You're not going to go anywhere. So you try to listen, and you try to discuss this with people that are actually asking true questions, like Nicole was saying. Those two groups, one group you're not going to reach. The other group that is just wondering and is genuinely not sure about all of the information and what to trust, what to believe. Those are the folks that we should spend our time and energy trying to discuss and engage and answer questions. And ultimately, Deanna, I totally agree again, is they have to make those decisions for themselves. And you can make those decisions about whether to travel or whether to get that vaccine. Those are your personal decisions that you can communicate with your family and friends.
That's fantastic, guys. And I'll make sure, I put my email back in the chat and everything. So if you ever have questions that pop up, feel free to reach out, and we can do our best to get you a good scientific-based answer. Next question, does the Delta variant respond well to any supplements? Should I keep taking my vitamin D?
Well, I checked for recent updates, and there still is not evidence that's shown that any particular supplements can help either with the prevention or to reduce the symptoms of COVID-19 or variants. However, it's always a good idea to support a healthy immune system. So that might include taking vitamin D if you're not getting adequate amounts from your diet or through sun exposure. So hold off on the supplements, but consider vitamin D if you need it.
Awesome, thank you. Switching gears a little bit, is there support for grandparents caring for their grandchildren in Larimer County? The pandemic has hit us hard, and I want to make sure my grandkids are adequately supported.
Yeah, thank you, Allie, and contributor to this question. There are, Larimer County has a number of nonprofits and agencies that are dedicated to supporting grandfamilies. I'm going to highlight two, and I'll also put their websites in the chat. The first one is the Grandfamily Coalition. The Grandfamily Coalition offers a monthly, I don't want to necessarily call it a support group, but a monthly gathering just for grandchildren who are being raised by grandparents. And I know that they were doing that in person prior to COVID, and they did switch to online. So I'm not quite certain where they're at right now. I know many of these agencies are still trying to navigate the risk tolerance and what grandfamilies actually want to do if they want to meet in person or online. But I will put their website into the chat because I know that they do have a primary focus for helping grandchildren. And then the second agency that has been supporting grandchildren for really the last 12, 13 years is Summit Stone Health Partners. Not only do they offer programming for grandparents who are raising grandchildren, but they do have monthly gatherings, supports, again, solely focused for grandchildren. So again, if you are worried about your grandchild, both of these agencies, I think, are useful partners in our community to help support grandfamilies. And they also know of other agencies that might be able to help if there's a specific concern that you have.
Thank you so much, Dr. Fruhoff. Is there any effect on the vaccine if I donate blood? Is there a length of time I should wait? And what about the flu vaccine? Should there be time in between that as well?
Mark, you want to take that first, and then I can.
Sure, yeah. So I was looking this up because I had heard a news report about the upcoming flu vaccines. And the CDC does, their guidelines is that you can receive those vaccines essentially simultaneously. So you don't have to wait a period of time in between those two vaccines. So I think that should be fine. And in terms of donating blood, that should not impact significantly your immune system's ability to generate a good protective immunity with the vaccines if you've donated blood before. So that shouldn't be a problem.
Yeah, I have nothing to add. I think that was a pretty complete answer. Thank you, Mark.
Thank you so much. What changes to activities are they recommending to older adults at this time? Is it different for those in assisted living versus living at home? Also, should my children not stop visiting my mother, who is in an assisted living facility now that they're back in school? I'm a little worried about how to protect her when they are around unvaccinated children all day.
Well, I can do my best to answer that one. I mainly work in nursing homes and do some assisted living care as well. And I really think the facilities are trying as hard as possible within the guidance of the health department to and CMS's guidance to allow for visitation at this point. I think it was really notable, the isolation effects that we witnessed last year through the pandemic. And so, you know, I think especially CMS for nursing homes has really been trying to honor the fact that that is, you know, a key point of someone's quality of life, and that we want to try to continue visitation as much as possible. I think the key is, you know, if your grandkids are visiting, most likely those visits are going to probably ideally be in an outdoor setting. They'll be required to mask if they're unvaccinated. A lot of the nursing homes are tracking that. So, you know, they want to know if you're vaccinated or not, because they are required to have more like a supervised visit if you are unvaccinated. So they really are trying to, as short of an outbreak status, continue to maintain that visitation. So, you know, and I think it's important to keep doing that and stay healthy and be interactive with other people, because social isolation is just as devastating as some of the effects that we've seen from COVID. So.
Yeah, I agree with Dr. Jackson. And if you're, you know, thinking about how you want to maintain the grandparent-grandchild relationship while not meeting in person, and you have the ability to use technology, perhaps the SNF Life Enrichment Coordinator has technology, can help coordinate with a grandparent, or that grandparent has his or her own technology. You know, meeting online, doing story time with the grandchildren is important, whether the grandchild reads to the grandparent or vice versa. You know, even doing show and tell. Again, you know, without knowing the age range of the grandchildren, there's a number of things that one could do. And then I would always just suggest reverting back to maybe having grandchildren send cards, create cards, write them letters. You know, that it's a nice educational experience for the grandchild to perhaps improve writing skills, but also maintaining those connections. So I think there's a number of things that, you know, we can think about, and I'm happy to help brainstorm ideas on how to help build those grandparent-grandchild connections if you're not meeting in person. But there's a number of things that we can do out there, because Dr. Jackson's just so right? Relationships are so important. So.
Thank you guys, that was great. I'm an older adult who lives alone, but used to have an active social life. I regularly meet up with friends and families for meals and walks. We have tried to start meeting back up again, but I find I don't enjoy it as much as I used to. I'm finding it much harder to socialize. How do I get back to enjoying spending time with others? I feel really guilty.
I don't mind taking a stab at this. So, you know, I think one thing to remember is I honestly don't know one single person who is exactly the same as they were prior to this entire experience. And so I think some people have learned more about themselves in terms of their extroversion and introversion, and what they enjoyed and what they didn't enjoy, but was part of their life. And so I think for a lot of people, there's been sort of a taking an inventory of what's changed. I think we're all sort of at some level still a little bit fatigued and a little bit anxious too. So just because you can go back and do these things that you did prior doesn't mean that everybody's going to want to do that or be able to dive in completely to their pre-pandemic life. So I think for most people, we've talked about this before, I think being mindful of maybe starting out with making an inventory of the things you do miss, and then trying to kind of create the new, hopefully someday post-pandemic life in terms of these are the things that I want to be doing. I will say, I think if any sort of like depressed mood or anxiety symptoms sort of come into play, you do want to be doing things. Like you do want to go out for walks, you do want to be exercising, you do want to be socializing. But I don't think that you have to kind of go in at the same level you were before. And I think it's just figuring out those little things that will get you interested. If you wake up and there's 10 choices and only one seems appealing, then go and do that one thing and don't feel guilty that day. Just be happy that you did that one thing that kind of got you back into a healthy level of socializing and exercising. And then just kind of give yourself a little grace and take baby steps. I think that people are all going to sort of return to either a new normal or a revised normal, and just knowing that that's okay and that you're not going to go from 0 to 100%, and just making those small incremental changes that are healthy for you but are not too overwhelming is kind of the best we can expect from folks at this point.
Thank you so much. I took up gardening while in self-isolation and have quite an abundant harvest. Is it safe to share these harvested veggies with friends and neighbors if I was sick while caring for them?
Well, I'm glad you asked that question, because first, if you're experiencing symptoms, please prioritize your care over the garden. And then second, since the spread of COVID-19 is from person to person, that act of sharing could actually be risky. So if you have someone else who can come over and harvest and distribute those vegetables, that's your better option. And I'm going to pass this over to Mark for more information.
Yeah, I think that's great advice, especially if you're currently infected with COVID. In terms of potentially shedding virus onto fruits and vegetables, I mean, I'm hoping that most gardeners rinse or wash their vegetables after they harvest them. So, and if so, that should wipe off any potential contamination that might be deposited that could contain SARS-CoV-2. But just realize that, one of the things we have learned throughout this pandemic is that surface contamination has turned out to be not as a big of a problem as we feared. And it's really this airborne transmission that's the most efficient. The virus doesn't live on surfaces very long. But again, I would definitely, wash those harvested fruits and vegetables before sharing those.
Right. Since the holiday season is fast approaching, can I host family and friends for holiday events? Can I pass out Halloween candy?
I can start with that, and then I'm sure there's others that have other great opinions and thoughts. Hey, I think that for hosting friends and family, I think it's really important that perhaps prior to a get together that you have a conversation and agree upon sort of everyone's thoughts regarding their own, risk tolerance and vaccine status and things. And so I could foresee some families, for example, saying, hey, everybody's vaccinated. We feel good about getting together. Other people may say, even though we're vaccinated, it'd be really great if everybody could just take a COVID test before you travel to come see us. All that's really valid. And I think it just depends a little bit on who's in your household and what types of exposures you might have. As we know right now, children under the age of 12 cannot be vaccinated yet. So that potentially represents a reservoir of infection, which should be very low risk to those who are vaccinated. But if you are immunosuppressed or have some other risk factor, you may, that may be a situation where you'd want to test, prior to coming, or see if the whole family can test. So I think there are a lot of ways you can handle it. And I certainly agree with the opinions that have been shared by Deanna and Christine, which is that, being able to see family is good for your heart and your soul, and it's good for your health overall. And so, finding creative ways to do that with kind of agreement from everybody, I think is really helpful. In terms of passing out Halloween candy, I'm kind of interested in other people's thoughts on this. I probably would say that I would be personally comfortable passing out Halloween candy with appropriate masking on myself. Again, and if it's outdoors, the likelihood that I'm going to be exposed to some infectious dose of COVID is very unlikely. So I would be comfortable, but I would certainly, say that it might be something to discuss with your doctor if you have one of those conditions, like you're on an immunosuppressant, or perhaps a very advanced age. I think those are things where there are nuances that you can't really create a one size fits all. And I'm kind of interested in hearing what you might have to say, Mark, about that.
I agree with what you just said, Nicole. One other aspect, though, that I'm thinking about and a little bit concerned about is the fact that you're going to have a lot of 12 and under kids, coming to your door, and less worried about, myself if I'm vaccinated, but more worried about bringing together this population that can't get vaccinated yet, and potentially, congregating around a candy bowl. And again, I'm not so concerned as much about the candy being contaminated as those kids coming together and transmitting virus through the air. So yeah, again, Nicole, you had some great recommendations. Keep the candy bowl outside. If there's some way you can try to limit the number of kids that come up to your candy bowl at the same time, maybe ask kids to wait at the end of your driveway or something as one person comes out. I know it seems like a lot, but that's my concern. I'd like to hear if there's any other opinions, but trying to manage that kind of crowd with the little kiddos, coming up to the candy, I think would be very important. I'm just so worried about that population because they have no choice. It's up to us to protect them, and not just at Halloween, but in schools too. Every child that gets infected and gets sick, and God forbid goes in an ICU or ventilator, or even passes away, that's on us, and we've got to do a better job of trying to protect them from this until they can get vaccinated.
Anybody else have thoughts on that? If not, I have a quick one. Go ahead, Dr. Jackson.
Oh, no, I was just going to say, like if you think about the high risk exposure per the CDC is that greater than within 6 feet, greater than 15 minutes in a 24-hour period. So in theory, multiple people who were positive, you could be exposed. But I think if you're masking and outdoors, that definitely decreases the risk. But yeah, I agree. It's important to protect our littles so that they're not spreading it around the schools as well.
Wonderful, thank you. And I think we have time for a quick one. Should I mask in all public places? What about outdoors in crowded spaces?
I vote yes. That's my 2 cents.
Yeah, I think a lot of certainly indoors or in crowds when you're kind of standing shoulder to shoulder is kind of where your risk is highest. Now that we know that this virus is spread through the air and less likely to be spread through surfaces, it's a matter of like the exposure that you have, not the density of exposure, as well as the time of exposure to get enough virus in your body to actually create an infection. So it's certainly important to avoid those situations or be masked in those situations. And, masking protects you, but there are various levels of protection. So for example, if you were going to be on an airplane for 15 hours, you know, that might be a time where I would be much more likely to think about an N95 mask. Whereas if I'm going to be, you know, going to the grocery store or something, you know, a regular surgical mask or cloth mask might be sufficient. I think there is, depending on how long you're going to be in there and how crowded it is. So I think there are certainly nuances, but certainly indoors right now, I think is probably a good idea to mask, and in crowds outside.